Hi everyone, hope you're doing well. Happy Woman Wednesday. Today we're going to be talking about menstrual health and uterine health and recognizing Fibroids Awareness Month. So we'll just give it a second to get our co-host Whitman-Walker in the room and then we'll get started. Hello. Hi Aunt Susan, hope you're doing well. In the interim, I'll introduce myself and kind of this space. So during the COVID-19 pandemic, Whitman-Walker's Community Health Department has expanded its outreach efforts to include the social media platform. We cover various topics about HIV and STIs. We just got Whitman-Walker in the room. For various topics about HIV and STIs, sexual health practices, access to care, social determinants of health, and public health interventions. Hi, Whitman-Walker. Thanks for joining. The community health team is here to educate and support you. So my name is Jewel, and I use she, hers pronouns, and I work to bring educational Instagram lives to this space with Whitman-Walker's Community Health Department. Today we're going to discuss menstrual and uterine health in recognition of Fibroids Awareness Month, which is this month, July. So let's start off with some basic stuff. What are periods in the menstrual cycle? Your menstrual cycle helps your body prepare for pregnancy every month. It also makes you have a period if you're not pregnant. So your menstrual cycle and period are controlled by hormones like estrogen and progesterone, and here's how it all goes down. Generally, you may be born with 2 ovaries, and each one of them holds a lot of eggs. These eggs are very, very tiny and too small to see with the naked eye. During a menstrual cycle, hormones make these eggs in the ovaries mature, and when an egg is mature, that means it's ready to be fertilized by a sperm cell. These hormones also make the lining of a uterus thick and spongy. So if the egg were to get fertilized by a sperm cell, it has a nice and soft place to land and start a pregnancy. This lining is made up of tissue and blood, like most of everything else in our bodies, and it has a lot of nutrients to help the pregnancy grow. About halfway through a menstrual cycle, again, which usually or typically lasts 28 days for someone, the hormones tell an ovary to release a mature egg. This is called ovulation. So most people don't feel it when they ovulate, but some people, as they're experiencing ovulation symptoms, they might experience bloating or spotting or a little bit of pain in the lower belly that may only be felt on one side of their body. Once the egg leaves the ovaries, it travels through one of the fallopian tubes toward the uterus. So if pregnancy does not happen, the body doesn't need that thick lining in the uterus, and the lining breaks down and the blood and nutrients and tissue flow out of the body through the vagina or front hole, and that's your period. If a person does get pregnant, then the body needs that lining, and that's why periods stop during pregnancy. A period comes back when a person is not pregnant anymore. So that's a little bit about pregnancy and periods and just how it all goes down. But some other questions that I think come up for a lot of people around periods and menstrual health is, when in life do periods start and stop? So a lot of folks will get their periods around age 10, 11, 12, 9. But all in all, if you have a uterus and you don't get your period by the time you're 16 years old, it's definitely a good time to go and visit the doctor or a nurse or a medical provider just to kind of gain some insight about what's delaying your period from starting. And then most people stop getting their period when they're about between the ages of 45 and 55 years old. This is called menopause, and menopause can take a few years. So I've heard a lot from elder women in my life who will have stopped their period for like 10 months and then all of a sudden get their period at the 11th month, and now they've got to restart their 1 year count, because after 1 year of not getting your period, it's pretty likely that you've finished menopause or that you will not be getting your period anymore. So heads up on that. But menopause can take a few years, and periods usually change gradually during this time, and after menopause is totally complete, a person cannot get their period anymore. People also are curious and wonder whether or not they can have sex while on their period. So if you're especially squeamish or like don't love seeing blood, maybe you should avoid avoid sex while on your period. But there's no need to avoid actual sexual activity during your period. Though period sex can be a bit messy, it is safe. And having sex when you're menstruating can actually offer a few advantages, including relief from menstrual cramps, shorter periods, and increased sex drive, natural lubrication, and relief from headaches. Just be sure to talk to your partner about, their comfort level with period sex and kind of the things that they expect going into it, and just make sure you're both on the same page about what to expect. Now, another kind of common period question is, can a person get pregnant during their menstrual cycle? Again, that's over the course of that 28-day cycle. So a person has the highest chance of getting pregnant on the days leading up to ovulation, or the part of your cycle when the ovary releases a mature egg. These are called your fertile days. Ovulation usually happens about 14 days before a period starts, but everyone's body is different. A person may ovulate earlier or later depending on the length of their menstrual cycle. An egg lives for about 1 day after it's released from an ovary, and sperm can live in the uterus and fallopian tubes for about 6 days after sex. So a person can usually get pregnant for around 6 days of every menstrual cycle. It's the 5 days before they ovulate and the day that they actually ovulate. They can also get pregnant a day or so after ovulation, but this is less likely. And since we talked about getting pregnant on your menstrual cycle, let's talk about pregnancy prevention and periods. So many people will track their menstrual cycles and other fertility signs to help them figure out when they're ovulating. This is called fertility awareness, and some people use it to prevent pregnancy and others use it to try to get pregnant. Some people have very regular cycles and other people's cycles vary from month to month. And it's really common for young people to have irregular periods. Since periods can be unpredictable, it's hard to know for sure when someone might ovulate, even if they're carefully tracking their menstrual cycle. So to avoid pregnancy, consider using birth control every time that you engage in sort of vaginal or frontal sex where sperm may also be present. Now let's go on to uterine health. According to verywellhealth.com, the uterus, also known as the womb, is the hollow pear-shaped organ in the female pelvis, or pelvis with reproductive anatomy, in which fertilization of an ovary or egg, implementation of the resulting embryo, and development of a baby can take place. It is a muscular organ that both stretches exponentially to accommodate a growing fetus and contracts in order to push a baby out during childbirth. So that's baseline definition for a uterus. For fibroids, we're going to go over a few different kinds of ailments of the uterus, if you will. One is fibroids, one is uterine polyps, one is a tipped uterus, and the final one is endometriosis. So starting off with fibroids, uterine fibroids are non-cancerous tumors that grow in the muscular tissue of the uterus. Fibroids often do not cause symptoms or require treatment, but for some women or people with uteruses, uterine fibroids lead to heavy periods or pain. Symptoms are typically treated with over-the-counter pain relievers containing ibuprofen or acetaminophen or hormonal contraception, and in severe cases, surgery may be required. Fibroids, non-cancerous growths of the uterus, often appear during childbearing years and affect 70 to 80% of all women between ages 35 and 54. Those numbers are even higher among Black women. 80% of Black women will develop fibroids by the time that they're 50 years old, compared to 70% of white women. Next up, we've got uterine polyps. Polyps are finger-like growths that attach to the walls of the uterus. They can range in size from as small as a sesame seed to larger than a golf ball. Many women and people with uteruses have polyps and don't know about them. But when symptoms do occur, they can include irregular periods, heavy bleeding, breakthrough bleeding, and infertility. Uterine polyps carry a small risk of cancer and should be removed with a surgical procedure as soon as they're discovered. So be aware of that. I think one of the big takeaways for today is definitely to schedule those woman exams and pelvic exams, and just making sure that you're visiting your gynecologist as prescribed in terms of how often you should go each year, or if you're going every couple of years for your pap smears and whatnot. So next up, we've got tipped uterus. Some women and people with uteruses have a tipped or tilted position for their uterus. This anatomical anomaly usually isn't detected until a person becomes pregnant, and usually is not an issue. However, some women or folks with a tilted uterus may have a higher risk of miscarriage or experience a pregnancy complication known as uterine incarceration. If that happens, a cesarean or C-section delivery will be necessary. And finally, we've got endometriosis. And so according to healthline.com, endometriosis is a disorder in which tissue similar to the lining of your uterus grows outside of your uterine cavity. Endometriosis occurs when endometrial-like tissue grows on your ovaries, bowel, and tissues lining your pelvis. It's rare for endometrial-like tissue to spread beyond your pelvic region, but it's not impossible. The hormonal changes of your menstrual cycle affect the misplaced endometrial-like tissue, causing the area to become inflamed and painful. This means that the tissue will grow, thicken, and break down. And over time, the tissue that has broken down has nowhere to go and becomes trapped in your pelvis. Now, the tissue that's trapped in your pelvis can cause irritation, scar formation, adhesions in which tissue binds your pelvic organs together, severe pain that occurs during a menstrual cycle, and also fertility problems. Pelvic pain is the most common symptom of endometriosis. You may also have the following symptoms. They include painful periods, cramps 1 or 2 weeks around menstruation, heavy menstrual bleeding or bleeding between periods, infertility, pain during sexual intercourse, discomfort with bowel movements, lower back pain that may occur at any time during your menstrual cycle. These are just a few of the different symptoms that are symptoms of endometriosis. It's important that you get regular gynecological exams, which allow for your gynecologist to monitor any changes. This is particularly important if you have 2 or more of those previously mentioned symptoms. And while endometriosis affects 11% of American women between ages 15 and 44 years old, according to the U.S. Department of Health and Human Services, a 2019 study found that race and ethnicity may influence its prevalence. So when compared with white women, Hispanic and Black women are less likely to receive a diagnosis for endometriosis. Alternatively, Asian women are 50% more likely to receive a diagnosis when compared with white women. Endometriosis has no cure, but its symptoms can be managed. Medical and surgical options are available to help reduce your symptoms and manage your potential complications. So pain medications, you can try these over-the-counter medications such as ibuprofen, but these aren't always effective in all cases of endometriosis. You can also try hormone therapy or taking supplemental hormones. Can sometimes help relieve pain and stop the progression of endometriosis. Hormone therapy helps your body regulate monthly hormonal changes that promote the tissue growth that occurs within the endometriosis. And finally, you've got surgery options, which includes lasering away the built-up tissue that's kind of got nowhere to go but has died off. And if this doesn't offer you relief, then a hysterectomy, which is the removal of the uterus and possibly other reproductive organs, may be necessary to help alleviate these painful symptoms. I want to thank everyone for taking a little bit of time to learn more about menstrual health and periods and uterine health and fibroids during Fibroids Awareness Month. But of course, before we go, we want to give you a few reminders about both COVID-19 and vaccines and monkeypox. So if you've already gotten your COVID-19 vaccine, congratulations. You've taken a really important step to helping prevent yourself, your loved ones, and your communities from illness. Multiple variants have soared across the world, and it's totally understandable if you want to keep wearing your mask, as the vaccine isn't 100% effective. It's very effective at, keeping you not super sick from COVID, not in the hospital with COVID, and not experiencing death from COVID, but does not prevent new cases of COVID. So stay alert, wear your mask if you're in tight, close spaces or very, very packed spaces and it's indoors. Just be mindful of that. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has COVID-19 vaccine available. Please call us at 202-207-2480 to make an appointment. Again, that's 202-207-2480. And if you're having trouble making an appointment with us or just not regionally easy for you to access, you can find more information for DC residents at vaccinate.dc.gov or by calling 1-855-363-0333. And if you're a Maryland resident, you can visit covidlink.maryland.gov or call 1-855-634-6829. If you're a Virginia resident, you can visit vaccinate.virginia.gov or call 1-877-829-4682. If you haven't been vaccinated and you're not looking to get a vaccine, please continue to follow CDC guidelines for mask wearing, quarantining, social distancing, and the like. It's very important that you consider getting the vaccine and discuss COVID precautionary measures with those around you and be mindful of masks and just keep your distance. But you want to be especially strong with this when you do not know whether a person has been vaccinated or not. Now for monkeypox, if you are in DC, you can pre-register for a monkeypox vaccine appointment at dchealth.dc.gov/page/monkeypox. Again, that's dchealth.dc.gov/page/monkeypox. Also a quick Google search of dchealth.gov and monkeypox vaccines will bring that page up for you. But you're currently eligible to be vaccinated in DC if you are a District of Columbia resident who is 18 years or older, and you are identify as gay, bisexual, or other men 18 and older who have sex with men or who have had multiple or anonymous sexual partners in the last 14 days. If you are 18 and older and a transgender woman, a non-binary person, or someone who's assigned male at birth who have sex with men, or if you're a sex worker of any of any sex, or if you're staff of any sex establishments where sexual activity occurs, like bathhouses, saunas, and sex clubs. And then just note that if you do go to get your vaccine and you meet the eligibility requirements, you're going to want to present your identification card with the DC address, your utility bill or other mail with your name and a DC address, or a current DC lease or mortgage with your name on it. These are all proofs of residency for getting vaccinated in DC. But thank you all. Be safe out there, be vigilant, and continue to wash your hands and be well. Happy Women's Wednesday.